introduce yourself to the patient? Hi, I'm student Dr. Lauren. Nice to meet you. I'm going to be doing your cranial nerve examination today. Alright? Okay. This admittedly is my first time ever having done a cranial exam. So bear with me. We're going to go through this step by step to make sure that your cranial nerves are fit and healthy. The fan is very loud today. Okay. Next, wash your hands. I'm going to put the gloves on. I think that's better. Do you like my plant? Yes, it is actually a type of lily, but it's lost its pink lily leaves because I'm not always the best at taking care of it, but I think it looks quite nice in my office. Okay. So, briefly explain to the patient what the examination involves. Okay, well, we're going to assess your different nerves. We start with the olfactory nerve, which is your nose, then your optic nerve, and then more eye assessments, and then sensory, like touches and things. Your face, we'll look at your face and your reactions, and your hearing. And there'll be some coughing, and we'll look at some of the muscles on your neck. Is that okay? That's a very loud engine. It'll be one of those fancy doctors. They like to come in their supercars. That's what you can buy if you stick in and become a really good doctor. So I've heard. Okay, we're gonna do the olfactory nerve. Okay, so have you noticed a change in your sense of smell? Did things smell a little bit different than normal, or? Okay. Well, we're gonna test you out on that. I have a pack of essential oils. There's lots of lovely ones. I'm going to pick some very recognizable scents, and you need to tell me what you can smell. Is that okay? I don't think you would get that one, or that one. Maybe this one. Everybody our ages use this. Okay. Give that a little whiff. What does that Yeah. Okay. Yeah, well, we would maybe put it on spots or in things to treat spots. Tea tree oil. Okay. I've got one. You should know this one. If your smell's working. Smell this. Delicious. It smells again is sweet. It's vanilla. Okay. What about this? It's lemon. Yes, well, lemongrass. I feel like lemongrass smells more like lemon than lemon does. Okay. Oh, that's a good one. Smell that. It's minty. Yes, it is peppermint. Okay, one more. This is a really hard one, but you can just describe what it smells like, okay? What's this one? What can you smell? A little bit musky. Yeah. Put spice in there. Good. It is the baby Jesus oil frankincense. Great. Okay. So we'll give a big tick for that. Yeah. Okay. You got all of them correct. So we're going to move on to your optic nerve. So the optic nerve should be examined by various modalities. Visual acuity with the Snellen chart. Okay, I have, it's like a little baby Snellen chart. So, I can't remember. 6 feet. No, 6 feet. Oh, hold it here. Okay. I need you to read the letters all the way down. So, the first one. L-T. F-P-H. O-L-C-F. D-H-J-B-S. E-P-T-Z-O. C-F-D-H-J. L-T-F-P-H. Okay. You did really well there. I think it was like a little bit too close, but we'll just say that that's fine. I think it's meant to be 6 feet, which that was not. I don't see how you could put that 6 feet away. Oh, I'm getting confused with 6 meters. This is meant to be like there. Oh well, it's fine. I think you're fine. Okay, we need to now do your visual fields. So I need you to cover your left eye. I think. Okay, I'll do it. So I'm gonna cover your left eye like this, and then I'm gonna bring my finger in to the different quadrants, and you need to tell me every time you can see my finger. Okay, so I'm just gonna do this. Okay. And then we're going to do the same with the other one. So I'm going to cover this. Okay. Your right eye. Okay. Okay, so I need to do the fundoscopy. So this is where I'm gonna just have a look. I don't want you to look directly at the light, okay? I'm just gonna have a look in your eyes. So just straight ahead, okay? And then if you can just look up for me. Yeah, and look down. And then over to your right. And then to your left. Okay, and then up. And down. And then over here. And then over here. Okay, I'm just gonna try and don't look directly into the eye, just look at my nose. Just gonna look in there. Okay. That's fine. We're gonna move on to the oculomotor, trochlear, and abducens nerves. 3, 4, and 6. We're gonna do a light reflex first. So I need to ask the patient, which is you, to fixate on a distant target. So I don't know. Can you see the drawers there? So if you focus on that, and I'm going to shine this into each eye, bringing the beam in quickly from the lateral side, and I'm going to look at your response. Okay. So just focus on that. Okay. Keep focusing. Okay, we're going to do pupillary accommodation. So I need you to look at the object here, this pen, top of the pen, okay? And I'm going to bring this within 10 centimeters of you, and I want you to follow it with your eyes, okay? Oh dear, already tired. Okay, so look at the pen, okay? And then I'm going to bring it in. Keep watching. There. And then watch as it goes away. And back again. And 2. Okay. Can you just look straight ahead, so like behind my shoulder? I just need to look at you. I'm looking for signs of nystagmus or ptosis. And I'm not really sure what those things are, but I'm looking for them. I can't see any signs of them. Okay, I need you to keep your head still, and I need you to follow this pen again. And I'm going to move it around in a H formation. You need to follow it. And I'm looking for nystagmus. Nystagmus. I need some sugar. I'll get some sugar in a minute. Okay, you need to let me know if you experience double vision at all throughout this, okay? Okay, follow this pen. That's good. Okay, alright. Now we're going to look at the trigeminal nerve. Which is fun. It's the sensory one. So we're finished with your eyes. Just some sugar. Would you like one? It's a malwan ball. Okay, let me know if you do want one. Okay. Both sensory and motor branches of the trigeminal nerve should be tested. Okay. So we're going to do the sensation one, which is a light touch and the pin prick. I love this one. I've been so excited to practice it. It's not going to be sore. Okay. So you need to close your eyes. And I'm going to gently touch areas of your face. And you need to tell me if you can feel it or if there's any changes in sensation. So like it feels different on each side, or like you can't feel it at all. Okay. So we'll do the soft one first. Okay, so just close your eyes. Now we're going to do the same with the pinprick. It's just like a little bit sharp, like not even sore. It's just different. Okay. So we need this one. And then we need to do the motor function. So we're going to check your muscles of mastication. So I need you to clench your teeth tight, like this. And we're going to palpate you, like this. I want to feel contractions in the temporalis muscle and the masseter muscle. I mean, it feels pretty tight. That's fine. Can you open your mouth and move your jaw from side to side? Like that, and then close your mouth again. Okay. Testing of the corneal reflex should not be performed unless sensory impairment is suspected. Well, I don't suspect it. So we'll cross that. We don't need to do that one. Okay, we're going to look at your facial nerve. We're looking at the muscles of expression. So let's have a look at the symmetry of your face. So just relax. Okay. It looks fairly symmetrical. Okay, can you do the following movements? So raise your eyebrows nice and high for me. Okay. Squeeze your eyes shut. Blow out your cheeks like a pufferfish. And smile. Give me your biggest smile. Okay, so now I need to do this again, but against my resistance. So I'm gonna hold your brow. Right, raise your eyebrows. Okay. Close your eyes tightly. Okay. Try and blow out your cheeks. And try and smile. Alright, we're moving on to the vestibulocochlear nerve. So we're going to be doing hearing. I'm going to whisper into your ear a number and make a distracting noise with the other ear, and then you need to repeat, okay? Okay. 9. Okay. 12. 65. 101. Okay, that's fine. And then we're gonna do this. So the random Weber's test. So I want you to tell me when you can no longer hear this, okay? Is that loud car back? Okay, and again. And one more time. Okay. I think that's fine. Then we have the glossopharyngeal vagus nerves. We can assess them together. So, can you cough for me? Ask patient to open mouth wide and say ah. visual, the palate and posterior pharyngeal wall. Go keep going. Testing of the gag reflex should not be performed unless bulbar impairment is suspected, as it's uncomfortable to the patient. So I'm not going to make you do that. Then we have the accessory nerve. It's purely motor branch to the traps and your sternocleidomastoid muscles. So if you can turn your head to each side against my resistance, so try and turn that way. And again. And the other way. Okay, and then the trapezius, I'm going to put my hands on your shoulder. And I want you to try and shrug for me. One. Again. And again. That one's fine. And then the last nerve is the hypoglossal nerve. It's a purely motor branch to the muscles of the tongue. So open your mouth. I'm going to inspect your tongue for any signs of fasciculation. Can't see any signs of wastage. It just looks like a normal tongue to me. And then can you protrude your tongue so as I can move it side to side for me? Okay, so my notes. So you patient has passed all cranial nerve tests. It is the impression of this trainee doctor that no damage has been done to the cranial nerves. You'll be pleased to hear that, I imagine. Obviously, if things change and you experience episodes where your eyesight changes, or you get some muscle wastage, you can't do some of these, your facial expressions and things, or smells are different and things, then obviously let us know. Okay. Are you happy with that and everything we discussed today? Yeah, so okay, if you need anything, you know where to find us. I hope I did a good job as a trainee. As I said, it was my first exam, so yeah, I hopefully will feel more confident doing more in the future. But yes, it was lovely making your acquaintance today, and take care of yourself